Nothing compares to a good night's sleep, and for many of us right here, it's just not happening.
Here to help us this morning is Dr. Ben Graef. Thank you so much for being here to talk about this.
It's my pleasure. I'm glad I got to get invited.
Most of us are sleep deprived. What's the bottom line? How much sleep should all of us be getting every night?
So there's a little bit of variability person to person, but for the most part, you're going to sleep about 7 to 8 hours. And we know this from long-term experiments in seclusion and things that we've identified the average person needs 7, 7.5, 8 hours.
What generally prevents us from getting a good night's sleep?
So a lot of things like, of course, certainly stress will play a role, caffeine plays a role, alcohol, and, in our 24-hour society where things don't close, the stores, the internet, cell phones, all these things will keep us up at night and limit our sleep. It's the first thing to go when we have less time.
It's the truth, isn't it?
Yeah.
Talk about snoring and sleep apnea.
So snoring is fairly common, as is sleep apnea. About 10% of people have it, and it's been increasing considerably as our society has gained weight, with the obesity epidemic. But it was well in existence even before this, too. So there's some degree of normal snoring, and then as it gets louder and you start to see breathing pauses and apneas, that's where we become really concerned.
So how do you treat sleep apnea?
So we would first make the diagnosis at the sleep study, and then we would treat it with different methods. So there's certainly the surgical methods, there's CPAP, which I talk to my patients about, and there's sometimes mandibular devices, and even just weight loss might be enough for the right person. So it's not always CPAP.
What are the results that patients are seeing once they're treated from these treatments? I see people turn around pretty good. I tell them that actually the worse your sleep apnea is, the better off you'll feel when you're done, because you are finally getting good restful sleep. And I've had many patients tell me that they've turned their life around or get their life back. They can play with their kids, they're not falling asleep at work or on Fairview Avenue, here around Charlotte, and it keeps us safer as well.
I tell you, so many people I've talked to can't sleep through the night, and it seems like that's become the norm. Is that normal?
It's not normal to wake up several times during the night and stay awake. It's normal to wake up about every 30 to 90 minutes briefly for maybe 30 seconds or so. Somehow along the line we got this idea that we should never wake up. But long ago, when we used to live before houses and things like that, we would wake up every 90 minutes to check our surroundings to make sure that it's safe for our area. And now that we have houses, we've still retained that biological trait.
Oh, interesting.
And we do the full night studies, we do daytime studies, we do what they call nap studies, and anything else your doctor might need.
So if you're having a hard time sleeping through the night, it's a good idea to go ahead and call the office and go. I think I have resisted coming in for a sleep study because I think I probably need one, because it freaks me out to think about laying there and having all this stuff hooked up to me. But it can really solve your problem and be what you need to get a good night's sleep once and for all. Absolutely.
And it's a lot of the fear, because, everybody's smart, and we have Google, and we see, oh my goodness, if I see a sleep doctor, I might get a CPAP, and I don't want to do that. So I give people a lot of, credit for having the courage to come see me, because they know what's on the other side, but they're so tired of being sleepy and so tired of having trouble that they want to come in.
At what point should you go in? After you have had a month of sleepless nights, or 2 months, or a year?
It depends on how much it affects you. Chronic insomnia is anything over 90 days, but it depends on how much. If it's starting to impact your life, if it's starting to impact your relationship with your spouse or your kids or your job, then certainly it's time to come in. You can try some things at home and see how it goes. That's a lot of people will do that for a little bit, but if it doesn't help, then seeking a professional help is very good.
Oh, very good. If you're having trouble sleeping, call Dr. Graef. Thank you so much.
Thanks for having me. I appreciate it. Everybody sleep well.
Sounds good. All right, still ahead on Charlotte Today.